Critical colon cancer symptoms you should never ignore. Why are colon cancer rates on the rise lately? And not only in the elderly, but also in younger individuals. In this video, we are going to discuss this concerning trend. Be sure to stay tuned until the end because we are going to highlight the common symptoms of colon cancer that you should be aware of. Welcome back to our channel, where we discuss several health issues and health tips. The topic of today is colon cancer. Colon cancer is a highly destructive illness, ranking third in terms of diagnosis frequency and second in terms of fatality. However, the challenge of fighting this disease is compounded by a powerful industry driven by financial interests, deceptive ads, and an abundance of misleading information. This often leaves patients and healthcare providers confused and misinformed. Despite common belief, genetics are not the sole factor in determining colon cancer risk. While family history may contribute to a small percentage of cases, lifestyle choices play a larger role. Recent research highlights the importance of diet and lifestyle in preventing or reversing the disease. Studies show that foods high in antioxidants can help combat chronic conditions. This growing field of research offers promising insights for the future of medicine. How can you tell if you have colon cancer? What are the initial signs of colon cancer? Which symptoms suggest the disease has progressed? How can you catch it early? What exactly is a colonoscopy and who should think about getting one? What are intestinal polyps and how can you stop them from becoming cancerous? And, above all, are there any natural methods to prevent and fight against this condition? Many mistakenly believe this type of cancer can go undetected for years as it starts as a small polyp on the intestinal wall. Symptoms may not show up early on, making it important for those at higher risk to get a colonoscopy, especially individuals over 45 or 50. Close relatives with cancer may need one sooner. Colonoscopies allow for visualization, detection, and removal of polyps, with symptoms appearing based on tumor size and location. It is worth noting that colon cancer developing on the right side of the intestine can be harder to detect. This is due to the fact that the stool remains watery during this phase. The intestine has not fully absorbed all the liquid yet. Consequently, it becomes challenging for a tumor to block the intestine at this juncture, unless it is highly progressed or has spread to other parts of the body, such as the lungs, liver, or bones. To detect tumors early, it's important to know that they often grow in a disorganized manner, causing invisible bleeding. One method for early detection is examining stool samples for hidden blood. Another effective method is undergoing a colonoscopy. Chronic bleeding can lead to iron deficiency anemia, so if you're around 45 or 50 years old and notice paleness and anemia, get evaluated for an intestinal tumor. Darker stool may indicate slightly more intense bleeding. Now, let's point out the colon cancer that arises in the left side of the intestine. Because feces in this region are more solid, blockages or obstructions are more prone to happen sooner. The left side of the intestine has lower water content than the right side. What signs and symptoms could a person potentially encounter? Before we delve deeper into the symptoms of colon cancer, make sure to subscribe to our channel and turn on notifications to stay updated with our informative videos. Okay, let's get started. A typical sign is a shift in bowel patterns. If you usually go to the bathroom daily or every few days, but now you're experiencing constipation for a week or more, be cautious. Also, watch out for changes in the shape of your stool, like it becoming thinner. You might also have bouts of diarrhea followed by constipation. Chronic diarrhea, which many people experience, may lead to a colonoscopy to rule out an intestinal tumor. As the tumor progresses, it creates a shape on an X-ray that looks like a bitten apple. This shape indicates that the tumor is causing a blockage in the intestine, making it hard for feces to pass through. Additionally, the tumor can lead to bleeding, which is usually bright red and easy to see. The stool may also look darker because of the blood. Other signs of advanced cancer, like right-sided colon cancer, include stomach discomfort from gas buildup, abdominal swelling, weight loss, tiredness, and persistent fatigue. Symptoms may also affect internal organs, such as liver pain or difficulty breathing. Early detection methods and natural preventive measures are crucial, so pay attention to the following part. What are intestinal polyps? Intestinal polyps are small benign tumors that protrude from the intestinal wall and usually do not show any symptoms. The best method to identify them is by undergoing a colonoscopy. During this procedure, the polyp can be seen and extracted for further examination in the lab to determine if it is cancerous or not. Nevertheless, there is a slight risk as some of these harmless polyps can develop into cancer as time goes by. This is where we delve into the main point of this video. What factors impact this transformation? As mentioned earlier, it's a combination of our genetic makeup and the way we live our lives. Contrary to what we used to believe, our genes are not fixed. Research shows that making smart dietary decisions can help prevent intestinal cancer by influencing how our genes behave. A well-balanced diet and healthy habits can reduce the activity of genes linked to chronic inflammation, dementia, obesity, heart attacks, and cancer. On the other hand, poor dietary choices and unhealthy habits can speed up the activity of these genes, leading to the growth of polyps and the development of tumors. What are the factors that increase the risk of colon cancer? How does a polyp progress into cancer faster? Factors contributing to this issue include consumption of ultra-processed foods, excessive intake of red meats, especially processed ones like ham and salami, unhealthy fats, high amounts of vegetable oils, excluding olive oil, sugar, and excessive sodium. These products, particularly when derived from ultra-processed foods, can fuel tumor growth. Ultra-processed foods have been recognized as carcinogenic. Other factors like constipation, poor gut microbiota, chronic inflammation, alcohol consumption, and smoking also play a role. What dietary and lifestyle choices can help prevent colon cancer? To lower the chances of developing colon cancer, it's a good idea to stick to a diet that's full of anti-inflammatory and antioxidant-rich foods. Make sure to include a variety of fruits and veggies in your daily meals. Spices like turmeric are great for their anti-inflammatory properties. Healthy fats, such as omega-3s from fish like salmon, tuna, sardines, and anchovies, or from plant sources like chia, flaxseed, and sesame, are also recommended. Avocados and eggs from free-range chickens are excellent sources of healthy fats too. Consider constipation's role in reducing cancer risk by ensuring adequate water and fiber intake. Prioritize healthy habits like sleep, exercise, and social connections for antioxidant and anti-inflammatory benefits. Incorporate nuts and seeds, such as pumpkin seeds, for intestinal health. Now let's discuss diverticular and diverticulitis. You might be wondering if it's safe to eat seeds, nuts, and the hard outer coatings of some seeds and nuts with these conditions. The answer is yes. Recent research with over 47,000 patients shows that consuming these foods doesn't raise the risk of diverticulitis or complications like bleeding. Therefore, patients with diverticulitis are no longer advised to avoid these foods. In fact, they can enhance intestinal health and function and possibly lower the risk of colon cancer. However, it's important to consult your doctor for personalized advice if you have any digestive problems. And that's it for today's video. We hope you found this video helpful and informative. If you have any additional insights, please feel free to share them in the comments section. Don't forget to like and share this video with your loved ones and friends so they can also learn about the important symptoms of colon cancer. If you're new here, subscribe to our channel and turn on the notification bell to stay updated on our future health videos. Thanks for watching. See you in the next video. And remember, stay informed, stay healthy.